Hello! Hi! Welcome to the 7th episode of Ask Giri, the Physio Show. Today's topic is Whiplash, injury to recovery, right? So that's why we are starting this episode in the car, because most of the whiplash happens in the car. So let's get going. Okay, let's talk about what are the causes of the whiplash injuries. The most common cause, I already told you in the car, that the car accidents, right? Whether it can be hit from the back or from the side, from the front, that's a very common cause. Then banging the head on something, on the wall. I treat a lot of people falling from the horses because I do have a lot of horse riders as patients, and they bang their head quite badly when they're falling from the horses. Or even playing with children in the house and playing with the dogs in the house, people bang their head on the wall and they can get whiplash also. You can get concussion along with it as well, right? And the falls. This is very common with the elderly when they have poor balance, and also some neurological compromise. When people fall, they also can get whiplash. And also sports injuries, very common in contact sports like football and hockey and things like that. You can have a whiplash injury as well. And the shaken baby syndrome is, it's not very common nowadays because parents are very aware of this cause. Like, if the baby's head is shaken too much, then sometimes baby can get whiplash as well. Since we are pediatric therapists as well, we do see some conditions like that sometimes, not from the shaken baby syndrome, but baby hits a head somewhere, unfortunately, then we have to treat the condition as well. That's one. So that's all the main causes for the whiplash injuries. Next, we're going to talk about mechanism. What actually happens when you get hit? Imagine, I'm going to turn to the side. Imagine you're getting hit from the back of the car. So what are you going to do? Your neck is going to go for a little bit of a acceleration and deceleration process, and then you're going to come back like that. It happens in actually the whole process of that interaction sequence, we call it. It happens in about 300 milliseconds, right? 0 milliseconds would be the impact of the other car in the back of your bumper. From the time there, and then 300 milliseconds, everything happens and finishes off, right? So because your head goes like this, like a whip, and that's why it's called whiplash injury. Actually, that was not the first term which was coined for this condition. Actually, in 1919, they coined the term railroad spine. Because a lot of railroad accidents, people used to get this injury. They termed the name railroad spine, but later it's changed to whiplash. Now the whiplash scientists and the researchers all over the world are discussing about, are we still keeping the name or are we trying to change it? And they ended up leaving it there for now, because even the classification, it's called WAD, whiplash associated disorder, has the name whiplash in it. So they don't want to mess up with those things. That's why they're leaving it there for now. So these are the main causes. Main mechanism is your acceleration and deceleration happens to your spine. When it happens, what are the things can happen? The sudden force stretches and tears the soft tissues. What are the soft tissues? There's quite a bit in the spine, as you can see in the slide. And you got your ligaments, you got your tendons, you got your muscles, you got your discs, facet joints, which is nothing but your spinal joints, right? And also your nerve roots. When the injury is really bad, you can get really serious injuries as well, other than the soft tissues what you see here. The serious injuries I would consider like spinal fractures and dislocations, spinal cord injuries and brain injuries. These are all some serious injuries which could be treated as well, but the recovery time will be longer. And we have seen patients from mild whiplash to the brain injury and spinal cord injury as well. Because as you know very well now, that we also treat a lot of neurological conditions in our facilities. So this condition is very common as well when you see. Like most of the times I've seen brain injury and spinal cord injury in severe head-on collisions, and also single car rollovers in the winter time. Hitting the black ice and then you just rolling, and then that's very common for the spinal cord injury as well, and the brain injury. So next, what are the clinical features? What do you feel? What do you feel when you have a whiplash, right? So sometimes when you're in the shock, when the accidents happen right away, when you're in the shock, you may not feel that much unless it's a very severe injury, and then the spasm starts setting in 24 hours to 48 hours. You feel stiffer and sore as maybe the next day or the day after, more than at the time of accident, and slowly the symptoms start coming up. Initially you'll have some symptoms, and later after a day you'll have some new symptoms. Maybe the day after you might have a different symptoms. So that's a normal course. If you're experiencing that in whiplash, it's very common. Most of the time you feel like a lot of pain and stiffness in the neck, very stiff neck, very hard to move your neck here around. Neck is mostly common, and also don't forget your upper and lower back also can get involved quite a bit because your pelvis is seated on the chair, and when the shearing force happens, acceleration, deceleration happens, the spine can get injured as well. And also the seat belt is here. A lot of times you can get also seat belt injuries. You can get a lot of strain and strains in this area as well, and the rib injuries, and also collarbone injuries and shoulder injuries as well is very common. And don't forget your jaw, because your jaw is very closely associated with your neck. So a lot of upper neck injuries also cause jaw issues, and also you can also jaw issues separately as well. And also you can hit your head in the steering wheel or in the side window. You can also get some concussion as well during these injuries. That's very common as well. And the neurological symptoms, either from the concussion or from the spinal cord involvement or the nerve root involvement during whiplash, can cause the symptoms what you're seeing there. You can have headaches, dizziness, and also blurring of vision, paresthesia. These are all we call red flags, and we will flag you, and then we will send you for further neurological consultations and investigations if needed, working with your physicians and the neurologist and a neurological physical therapist as well. So that's a different chapter there. It's not very common, but headaches are common, and dizziness, we'll talk about it more, and it can come from your brain. If it's a concussion, it can come from your upper neck. If it's a cervicogenic dizziness, we have to rule out, and then we have to approach it in different ways, right? And psychological part, do not forget that, right? You can have memory loss, you can have sleep issues, you can have cognitive impairment, and also fatigue. You can be depressed, because so many things happens after a car accident, right? So you can just call it a fender bender. Then you're dealing with the insurance companies, a lot of phone calls, emails, you're putting a claim on, you have to take the car to the body shop, and you got to get that appointments going. You're basically entangled in a whole bunch of appointments after car accidents, right? One with the insurance companies, one with your doctor's office, one with your physio clinics, one with your body shop, and one with your family members. If you don't have a car, one with the rental company, you have to rent a car. Then who's dropping the kids, who's picking up your coworker, or who's dropping the spouse. There's so much has to be done in one simple accident. So that's more stressful. And those are the stressful factors. And also don't forget the post-traumatic stress disorder. That's also very common. That's a big chapter of whiplash management. Some people will get into that category as well. I have maybe like 3-4 patients actually recovering from a post-traumatic stress disorder as well. That has to be managed with the help of a neuropsychologist and the psychologist. And we have some wonderful team of medical professionals in Edmonton, great doctors, great neurologists, great physiotherapists, great psychologists, neuropsychologists, occupational therapists, vision therapy guys, concussion therapists, vestibular therapists, audiologists. So we have such a nice team out there to take care of the patient with great communication and great skills that I'm really proud of. And don't forget chiropractors as well. And I'm very good relationship with some of the chiropractors who kind of help us when we are stuck in some places, and they can help us with some of the, as a team member as well. And massage therapists and athletic trainers, sports strength and conditioning specialists, and all of them are in our team so that we can work together on this. So the next we're going to talk about the grading. So we talked about whiplash associated disorder. So the Quebec Task Force has created some grading to classify these injuries, right? 0, 1, 2, 3, 4. You can see in the slide there, 0 is like nothing, no neck pain, no symptoms, but you still have to get assessed to see if there is any silent symptoms are there to rule out, which may come back later and bug you. You have to watch about that. And also grade 1 is your just mild neck pain and stiffness, no other physical signs, no other musculoskeletal signs, right? And WAD 2 is very common, neck symptoms with musculoskeletal signs, right? You can have a spasm, you can have stiffness, you can have soreness, reduced range of motion, and reduced functional activities, all those things. That's the most common thing we see. And the WAD 3 is when there is presence of neurological signs and symptoms, right? You can have numbness, tingling, right? And you can nerve root symptoms, like it can be a motor signs or weakness or sensory signs or numbness, tingling, or it can be autonomic signs, or it can be central signs, either your spinal cord gets injured or brain gets injured. We can pick up those different signs. Then you will be categorized into WAD 3. And WAD 4 is when you have fractures and dislocation of the spine, and it can be a little bit serious, that you might have to go for surgery sometimes if it's dislocated, and they have to stabilize the segments first. Then you have to follow the post-operative protocol, and then you have to take care of the other whiplash symptoms and concussion symptoms, other neurological symptoms as well. So this is a brief introduction for the WAD, what you know or you may not know. Okay, next one we talk about what are the prevalence of symptoms when you hit a whiplash? What are the common symptoms we see? As you see in that study there, the very, very common thing is your neck and shoulder pain, right? And also when you get shoulder pain, we have to rule out, is the shoulder pain coming from the neck, referred from the neck because of the neck is traumatized, or you did injure your shoulder itself. There's a lot of reasons, it depends how you're positioning your hand on the steering wheel, right? How do you hold your steering wheel? Depends on the impact in the back or from the side, what kind of force transmitted into your shoulder, how strong the grip you had on the steering wheel, how your elbow is bent or straightened, your neck is turned or not turned or rotated. Everything matters. Everything depends the intensity of the injury and the impact of the force, right? So neck and shoulder pain is very, very common. Headaches is very common. So most of the times headache starts really bad, then it subsides once the neck started moving and spasms start go down. Sometimes you can have some chronic headache issues as well. And then you can see the numbness and tingling in the upper limb and the lower limb. Depends on where your nerve root is not happy. Right? Depends on that, you can feel that as well. Ringing in the ears, medically we call them tinnitus. It can also happen from the neck and also it can happen from the brain. So again, we have to rule out where it's coming from. We have to manage that. Most of the times in whiplash, we see the tinnitus originating from the, we call the paracervical musculature or the upper cervical nerves. If there is some relationship between that, your trigeminal nerve and your upper cervical spine and the muscles around that area. We don't want to get into the neurophysiology of tinnitus, but just let you know, it's not uncommon to have ringing in the ears. It can be both sides, it can be one side, whatever it is you need to take care of. And concentration problem and the depression and the low back pain also is very common. So these are the things we have to take care when you have a whiplash associated injuries. Now, chronic whiplash. Some people can have prolonged pain, after most of the whiplash injuries, we can get them better in 8 to 12 weeks and they discharge with home program, they go and functionally back to functional activities, recreational activities and occasional activities. But some category will go into the chronic category, which might be made out of 3 months, 6 months, 8 months, 10 months, even a year. Depends on what are the different factors involved in the injury, how severe is the injury, and also what are the other factors involved. As you see in that cycle, the biological factors, the legal factors, the lawyer is involved. So how are we going to deal with that? The legal proceedings, how are we going to deal with that? Your own beliefs and attitudes towards pain and recovery, that matters a lot. Your past experiences, your past medical history, and how you deal with stress in life. How is your personality to deal with that, and how you handle everything as a human being. That matters. And the economics. Yeah, so when you don't have a car to drive and then economics change, right? You can't go to work, you can't do certain things. What are your side job or a side hustle? You may not be able to do that. So how is that going to be taken care of? Is insurance company sending you checks properly? Are you gone back to work? Are you still off work? Disability benefits, there's short-term disability, long-term disability. There's so much of economics involved in motor vehicle accident, and that also we have to deal with. And psychosocial aspects of it. That's what we talked about, the stress, the depression, the sleeplessness, poor concentration, memory issues, and all those things. And also sometimes you're very anxious, sometimes you're not yourself, sometimes you're mad about what happened to you. It may not be your mistake. You're so frustrated and angry, and sometimes that might come out with your family members, with your colleagues. So we need to deal with that. That's when the psychologist comes in. That's when having that open communication between you and your therapist and your family members come in to tackle that, right? So whiplash, where to start, right? We're going to little bit details about what are the things we can do, where to start, like what processes underlie whiplash associated disorder, what the recovery pathway looks like. Can we predict who will actually recover and who don't? Is there a way to do that? Wouldn't it be awesome? There are some predictors, we'll discuss about that. And we're also going to discuss about, does the current treatment work? Are we doing the right things? Are we doing the good outcomes? Or can we do something better than what we are doing to get better outcomes? So we have to ask ourselves those questions as a clinician as well, right? And so that we have to reflect on that to provide you the best possible evidence-based care in the world and right here in this city. And because we have awesome physiotherapists and awesome medical professionals in this town as well. Okay, so what are the processes of whiplash associated disorder? Sorry, I have to use some medical terms here to explain. I'm not going to do much detail of that, but I'm just going to briefly explain the top 4 processes happen with whiplash associated disorder. The first thing is your movement and motor dysfunction, right? So that's all about your muscles and joints. there is a lot of studies out there. I have backup studies and research for every sentence, every word I've used in this presentation. So if anybody wants any kind of evidence or want the article behind this terminologies I'm using it or the points I'm using it, feel free to reach out to me. Email me at giri@physioshow.ca, or there are a lot of other ways you can contact me, and I can provide you the research evidence for those things. So movement and motor dysfunction is all about muscles and joints. So there is evidence that your muscle firing and the muscle recruitment is altered after the whiplash associated disorder, or whiplash injury, let's call it, after a motor vehicle accident. So the motor patterns change, right? Pain inhibits movement, and pain also alters your movement patterns. And so a lot of altered muscle work and altered muscle firing and recruitment can change the way you move, change the way you recruit the muscle fibers for a specified task, and it can also alter. And the joint cannot move properly because it's very stiff and there are a lot of spasm in the muscles around it. So all these things can happen with the motor and movement dysfunction, right? Next one is augmented nociceptive processing. That means how your pain is being processed in your body, right? And in this one, to explain better, if you haven't watched my Pain 101 episode in my physioshow.ca website or in the show before, please, I would strongly suggest you to watch the Pain 101, and you'll get a better understanding how your body processes pain, and what we thought pain is 20 years ago is totally different than how we handle pain now. Because what I studied in school is gone. It's proven wrong, right? So we have to keep updating our research and evidence so that we know exactly how to manage pain and what is pain, what is not pain, right? So how you are processing your own pain signals, how it's going from the tissues, and what are the things coming from your brain, and your psychosocial factors, your emotional factors, right, and environmental factors, everything contributes to how you feel your pain, right? And that's what is nociceptive processing. Nociceptive means pain stimulus, right? And the stress-related factors, we already discussed about that, and PTSD, post-traumatic stress disorder, is also common in whiplash injuries. Psychosocial, socio-cultural, and environmental, we talked about that as well. So don't just think it's just a tissue injury and pain you're dealing with. You're dealing with much more than tissue injury and pain. And I want you to remember that. Everything matters, not just the injury, right? And how you're able to handle that. Now, we're talking about what are the facts. There are some facts. Sorry about the busy slide here. I used this information from a study from Young et al. Mainly I want to show you is, I want to let you know that you don't have to be in a high-speed accident to get severe whiplash injuries or any other injuries. Research has proven even at 10 kilometer speed, if somebody hits you, you can have a whiplash. Low-speed accidents can happen. It all depends on how you're positioned in the car. We're going to talk more about it, your position in the car. That's something you can alter. Even sometimes, unfortunately, if you're in an accident, that proper positioning, proper headrest position, and the proper positioning of your legs and seat position, everything matters when it comes to an accident. You can also prevent some of those things, extent of the injury, by positioning yourself properly in your car, right? That's where we started the thing, from the car there. And also we here in the study says that 93% of the time, the headrest is not positioned optimally. 93% of the time. So first thing you're going to do after you finish watching this episode, go to your car and check how your headrest is positioned, and sit in your car and check how is your positioning in the car. We're going to discuss about it, what is good, what is not good. And I want you to please spend 2 minutes to sit in your car and adjust your headrest, adjust your seating positions. So in case if you get an accident, sometimes in the future, your intensity of the injury and the impact of the injury will be a little bit less compared to if you're not positioned properly. Okay. And also there is a point here about how the automobile companies are doing a lot of research to absorb the shock coming to your body by using different mechanism. And Volvo has this whiplash protection seating system where the seat absorbs about 50% of the force coming to your head or your body. So these are something to look into for your own research before you buy your vehicle, and also safety standard ratings and also your positioning. Okay, now we're going to talk about how it can be prevented. There's a diagram in the slide you can see, just to give you some clue there. Right, the top of the head restraint should be at your top of the head. So the head finishes here, the headrest should be here. Okay, it should be right on the top there. So if you don't have it like that, you have to go adjust it properly in that. So this slide will kind of explain to you why it is very important. And also I have a couple of slides here, and you can see what is right, what is wrong in that slide, in that picture. And look at the guy on the top, and his head is nicely rested on the headrest, and it is extended up to the top of the head. And the bottom, you see, he is much more forward, and there's so much gap between his head and the headrest. And what happened, that gives you much more room for the head to swing, and then your acceleration deceleration force can be quite big, because there is no stop in there to prevent that too much, right? So this is the slide I want you guys to remember, and adjust your seat the headrest accordingly. And there's another example where your headrest is too low. It is not, see in the first picture how high the headrest is, with the head is actually almost on top of the head, right? The bottom one, you see how much low it is. So you don't want to be there. So this is the only simple things you can do, because we are in Alberta, we do get snow, we do get unfavorable road conditions a lot of time, that's 6 months of the year, I guess. So it's always good to be prepared, right? And better safe than sorry. That's the headrest position. And also don't forget about your leg position as well, right? A lot of people drive with the knee very close to the dashboard. So you make sure you have some good space between your knee and the dashboard, not very close. So when you have an impact in the back, your knee can really get jammed into the dashboard quite hard. And then sit all the way up into the seat nicely, so that is also very important to protect the whole spine and the lower back and everything. Those are the small tips, okay? Next, I'm just going to have a sip of water before we proceed further. You can also take a stretch break, a water break. So, the next slide, know your rights. This slide is specific to Alberta, even though because some of my viewers are in States and from UK and the other parts of the country as well. So, this slide is mainly for Alberta. In Alberta, you are covered by law. If you are in an accident, do not worry. Just let your insurance company know and then start your treatment. Do not wait for anything. Okay, and your physio clinics and your chiro clinics have all the paperwork you needed. You don't have to wait for any forms coming from the insurance companies. We all have all the forms what you need. So do not wait. Inform your insurance company that you are in an accident, start a claim, get your registered name and number, and come to the physio clinics. Do not wait to get anything else. And we can get your treatment started. And you also consult your physician, and then you can come to the clinic as well. Or if you think we need physician referrals, we'll send you to the physician right away. And if we identify the red flags, we send you to the appropriate specialist referral as needed. Okay, and you can seek treatments at any physiotherapist in your community you want, because we do have certain insurance companies and adjusters telling the patient to go to certain clinics, and they call it as a preferred provider. You don't have to. You have all the right to go to your own physiotherapist in your community and seek treatments. That's something I wanted to send the message as well. And also we have something called in protocol and out of protocol treatments in Alberta. That means the first 21 treatments, which comprises of your physical therapy, massage therapy, chiropractor, acupuncture, everything. That's called in protocol treatments. After that, if you need more treatments, the therapist will request for more treatment. That's called out of protocol treatments, where you have to access your private benefits first. Once you exhaust it, then the insurance companies would pay for the rest of the treatments, whatever you needed. And if you do not have private benefits, insurance companies would directly mostly pay for your treatment. Sometimes they'll ask you to pay first and then you get reimbursed for the treatment. So in any way you are covered. So do not worry about anything. If you're in an accident, inform your insurance company, start your treatment, and you can see any physiotherapist or any medical professional you want, and you don't have to just go to the therapist what your insurance adjuster is suggesting. And evidence-based treatment approaches. We can talk about it all day. I don't want to go into much details. And in our clinic, we approach it by detailed history taking, proper thorough assessment from head to toe, not just your neck, not just your back. The full body assessment will be done, and most of the clinics are really good about it. And then identify the red flags, talk to you about your injury, explain about your injury, then start with the treatment. It can be with manual therapy, modalities as needed, and also referrals to important sources if you have to, and education, and also addressing your stress factors. If there's concussion therapy will start. Vestibular therapy would start if you have vestibular symptoms, and if a neurological approach will start if you have neurological symptoms, right? And if you need a psychologist referral, it will be happening right away. And if you need massage therapy, it will be referred right away, or acupuncture, whatever is needed, it can be done. But the first and foremost is activity and exercises are the most evidence-based approach treatment for whiplash. And with your therapist's guidance, you can start moving as soon as you clear your red flags, and then appropriate graded exercises, what you need, starting from the simple stretches and mobility exercise and flexibility exercises, going into muscle retaining exercises, functional retaining exercises, then strength and conditioning exercises, and then reaching a functional goal and discharge with the home program. That's a whole course of treatment, depends on the type of injury and what kind of services you need. So tips for successful recovery: if you're in a whiplash or car accident, understand your injury and pain. That's very important. A clarity about your injury, a clarity about your condition and why the pain is coming to you, and what can you do better to tackle the pain, and how can you get moving, right? That education is very important because that is the best medicine. Knowledge is the best medicine, isn't it? And then consult your physio or your healthcare practitioner sooner in a community, and start moving right away. As soon as you ruled out red flags, start moving. That's a very important thing you can do, right? Personally, for me, personal story, I had 2 accidents myself. One about 15 years ago. Somebody stopped in front of me without putting the light, and I have to rear end in kind of thing. I went through some neck and jaw issues, and it all got better. And then recently, last year in the cricket ground, somebody backed into me in the parking lot. Actually, that was a T-bound. That impact was not that bad, but I had a lot of left side neck pain and ribs pain. I still having some rib pain here. Working, my colleagues, wonderful physiotherapists, my colleagues are still helping me to get better. So, being positive and taking right treatments and having a right approach always heal, because I can assure you that you can recover better just with my personal experience. So that's kind of wrap up our presentation today. I kept it as short as possible, and if you need more information, or if you're in an accident, if you need to talk to a physiotherapist about your questions, please give a shout to your physiotherapist. He can explain to you whatever you need. Okay. Now let's move on to the questions from the audience. This one is from Jason from Edmonton. He asks, is it common to have dizziness and vomiting in whiplash injury? Yes, you can have dizziness and vomiting. As I told you, it can come because of the concussion. You could have had a little bit of a brain injury, a mild, moderate, severe, whatever it can be, hitting your head on the steering wheel or side, or what kind of impact, or if it's a sports injury or you're falling on the ground, you hit your head, you get a concussion. At the same time, when you go to the back, when you hit your head, it's a concussion, and also you jar your neck also. So you can get whiplash and concussion, they can come together. So it's very common. Dizziness can come from your brain, but also dizziness can come from your upper neck as well. It's called cervicogenic dizziness, right? Because the upper neck has a lot of small sensors, like a small chips, which tells your brain and which coordinates with your inner ear and in your eyes, telling you the position of your head and the movement of the head, the amplitude of the movement. And a lot of sense information is going, and your brain is taking all the information coming from your upper neck, your eyes, your inner ear, and comparing everything and see everything is okay. If there is a mismatch in that information, it's going to make you feel dizzy. Okay, that's your cervicogenic dizziness. That can be assessed and ruled out and treated very well. We have a lot of very specific exercises to treat that. The term, we call it cervicocephalic proprioceptive retraining exercises. It's a very fancy term, basically working on the joint position sense in your neck and the muscles around it, using laser and some exercises and things like that on your forehead. So definitely it can happen, and you can talk to your therapist and we can deal with it for sure. You don't have to live with it. The next question is from Amy from Stony Plain. Amy asks, how do you treat chronic whiplash injury, right? So first of all, our main aim is to get you better and not get you into the chronic stage at all. And in case if we get into the chronic stage, or sometimes people come to us in a chronic stage because they could have gone in different places, different facilities for acute, when they're acute and they didn't help them, they went home, they get discharged, they're still not getting better, and then sometimes they come to the clinic with a chronic whiplash injury as well. So we have to approach it a little bit differently. Lot of pain education, a lot of motor relearning, lot of task specific training, lot of functional training, and also the team helps us with the psychologist and addressing the biopsychosocial and occupational therapy, return to work, vocational therapist, and your physician, and whoever is needed in the team. We can all work together to get you back on your feet and get you back to attain your functional, recreational, and vocational goals, whatever it is you want to get back to. So definitely, Amy, we can take care of the chronic whiplash injury, or your therapist can take care of it very, very well. And we are knowledgeable and very resourceful and skillful for that. And so That's the end of the episode today. Whiplash injury to recovery, and for the Ask Giri the Physio Show. So if you found this helpful, please like, subscribe, and share with your friends and families. And also, if you missed any of the past episode, this is the 7th one. We have 6 episodes nicely organized and kept for you at physioshow.ca. You can visit there and leave your feedback for me, and email me also giri@physioshow.ca. Then we can go from there. The next episode, I think we're going to talk about lower back pain sometimes this month, and we'll see you soon in that episode. Until then, stay active, keep moving. Bye. Happy Thanksgiving, by the way. Enjoy.